Hello, my name is Christina Smith, and I'm a public health nurse with Ottawa Public Health. I work with the mental health team. Today, I would like to talk with you about helping your children cope through COVID-19. The COVID-19 pandemic has been a difficult time for many of us. There have been changes to our routine, not being able to see friends and family the way we used to, and images from the media have also been hard. It's been especially challenging because we've been in this pandemic for over a year. And as a parent, you're not only trying to protect your mental health, but also that of your children. In this short video, I would like to share some tips with you about how to be more resilient, how to help your children be more resilient, and I'll also share some community resources with you should you need that additional support. Before we begin, I'd like to start by honoring the people of the Algonquin and Anishinaabe Nation who have lived on this territory for millennia. Their culture and presence have nurtured and continues to nurture this land. I would also like to extend that honor to all First Nations, Inuit, and Métis, their elders and their ancestors, and their valuable past and present contributions to this land. Let's start with the first tip. Realize that your children may experience many different emotions. This is not a normal time, but it is very normal to be having different emotions and feeling stress. Take a few minutes to ask how they're doing and look for changes in their behavior. Are their emotions a lot stronger than before? For example, angry outbursts, depressed mood, sense of panic. Do the changes in behavior or emotions last most of the day, every day? Do the changes last for a sustained period of time? So example, more than a week. Do the changes seem to interfere with your child's or youth's thoughts, feelings, or daily functioning? This might look like not doing activities that they normally enjoy, crying more than usual, or they may not interact with you as much as they usually do. There are things you can do to help decrease your child's stress. You can make sure that they're getting good sleep. You can make sure they're eating healthy foods and make sure that they're getting outside and having fun physical activity. Be patient with yourself and with your children. Keep calm with your kids, and as much as possible, try to help them understand the current situation. But realize that you may also be feeling added pressure and stress. Be patient with yourself too, and look for supports. You can help your children be more resilient. You can practice deep breathing techniques together or meditation. Another thing you could try is to think of something that you're grateful for every day and make a list. And when you're having a particularly hard day, refer back to that list. Maintain a routine. As much as possible, try to maintain a routine similar to what you had before the pandemic. Something that you could try is going to bed and getting up at the same time every day. That routine will help both you and your children cope. Focus on things that you can control. There's a lot right now that we can't control, but there are things that we can. We can control what we're putting in our body and eat good food. We can wear a mask to protect others and ourselves. We can wash our hands frequently. We can help others, and we can try to control our thoughts and use positive self-talk. Ensure that you're building in some fun into your kids' day. Make sure to have fun every day. There are a lot of added pressures right now with school and work, but take breaks. It's really important to find things that you like to do together, like playing board games, singing, or dancing. Stay connected with your loved ones. We can't get together the way that we used to right now, but it's still so important to stay connected. You can call or text. You can set up video chats with your loved ones and your kids. That's a nice way for them to stay connected too. Seek support when you need it. In the next few slides, I'll go through some resources that are available to you within our community. We're very fortunate to live in a community that has free mental health resources, and I'd like to highlight a few. The Mental Health Crisis Line is available 24 hours a day, 7 days a week, and you can call them at 613-722-6914. They're available in both English and French. There's also a brand new resource that's been launched called Access MHA, and you can learn more at accessmha.ca. This portal provides a single point of entry to Eastern Ontario's system of care for mental health and addictions. Anyone looking to access mental health or substance use support or services can complete a form online, and then they'll be paired with a trained mental health and addiction professional who will connect them to the services that they need from a network of partner organizations. For child-specific community mental health resources, you can contact Crossroads Mental Health Services. Learn more at crossroadschildren.ca. They provide free mental health services for children under 12 and their families, and you can call them at 613-723-1623. For youth in our community age 12 and older and their families, you can visit Youth Services Bureau at ysb.ca. You can call their mental health hub at 613-562-3004. Or if you need their crisis line, you can call 613-260-2360. We also have short-term counseling services available. So one of these services is counselingconnect.org, and they're available for all ages. They offer specific services to people in the African Caribbean Black community, the LGBTQ2S community, as well as people in the Indigenous community. You can book an appointment with them at counselingconnect.org, and you can book an online video or phone counseling service. There's also the walk-in counseling clinic that is partnered with Counseling Connect, but they provide in-person counseling when public health measures allow for it. And they provide services in multiple languages, including English, French, Somali, Cantonese, Mandarin, Arabic, and Spanish. You can contact them online at walkincounseling.com or by phone at 613-755-2277. I would also like to highlight Parents Lifeline of Eastern Ontario. They're a peer support group for parents who have children that are experiencing mental health challenges. They provide family peer support through integrated services specifically designed to support parents when, where, and how they need it, and to work together so that parents can move seamlessly between them. For more information on these resources and many more in our community, visit ottawapublichealth.ca/COVID mental health and go to our mental health and substance use services and resources page. Thank you, merci, and Meg Witch.